I've been treating people with arthritis for over 10 years now. In that time, as well as plenty of success stories, I've made some awful mistakes with many of my patients. In today's video, I'm going to reflect on my 5 worst mistakes. And if you have arthritis, hopefully you can use this information to avoid these pitfalls. My first and arguably biggest mistake made when treating arthritis patients was writing someone off just because of an ugly looking x-ray. When I was early in my career, I worked in a hospital where doctors would refer us patients after they'd had an x-ray. And many of these patients' x-rays looked quite severe. The doctor had often told them, you probably need surgery, but you have to go and see a physio just to check a box. Now, when I was younger and less confident, I used to look at those x-rays and think, well, what can I do? The joint is in a really bad state. I'll send them straight for surgery without even trying physio first. Looking back on this now, this might actually be the one I feel the worst about. I remember one lady in particular who had an arthritic knee. I thought deep down I could probably help her, but she asked to be referred to a surgeon and I just sent her straight on without even trying. I saw her a few months later after her knee operation, and it wasn't much better. In fact, she was really struggling. She was only 65 years old, and I still feel awful about that case even today. If I'd known better and been confident in what I know now that I can do, I would have told her I could have helped her there and then and spared her from surgery. This still really bothers me today, genuinely a lot. The second mistake I used to make when treating arthritis patients was only treating the affected joint. Now, if you have an arthritic knee, it's obvious that your knee needs to be mobilized and strengthened, but you can make huge gains in mobility if you work on both the hip and the ankle too. And this principle applies everywhere in the body. Now, when I have a patient with an arthritic knee, here are some of the exercises I often work on. Just to make you aware, the exercises in this video are not going to be suitable for everyone, so do get checked out before you give them a try, and if they cause you any pain, just avoid them. With an arthritic knee, strengthening the glutes around the hip can be super effective, and the clam is one of the best exercises to do that. To do this exercise, you just need to lie down on your side. You're going to put your hand on the bed like this and roll slightly further forward than feels natural. Bend your hips and your knees to about 90 degrees, keeping your heels together. Just lift that top knee without rolling back, just until you feel some emphasis on your glutes, and then lower it back down. I'll show you again. Lift up like this, just to your maximum before you roll back, and then back down. Doing somewhere between 10 and 30 of these in a row several times per day can be an amazing way to protect your knees. I often give out heel raises to strengthen the calf muscle because the calf supports your knee just as much as some of the other muscles around it. For this exercise, you just need a step. I'm going to use a little step like this, but your bottom step is absolutely fine. Stand with just the front of your foot on the step on both sides and your heels hanging down until you feel a stretch in your calf. Hold on to something for support just to keep you safe. And the exercise is really simple. You're just going to push up onto your tiptoes and then very slowly come back down to that stretched position. Hold for a couple of seconds and then push up again, and then keep coming back down. Keep doing that until you get a working ache in your calf muscles several times a day to strengthen them and protect your knee as well. Another exercise that doesn't involve the knee that I almost always give out for knee arthritis is the calf stretch. And your calf lives down here, but it does have attachments above the knee. So if it gets tight, it can compress that knee joint. Here's how the stretch looks. Stand with your hands against the wall, put the leg to be stretched out behind you with the heel down on the floor and both feet pointing parallel. Keep that back leg straight and the heel on the floor and bend that front knee until you start to feel a stretch in your calf at the back. Once you've got that stretch, hold for 30 seconds and you can return to this stretch several times a day for best results. Note how none of these exercises involve the knee, but their effect on the knee joint is massive. Now, this principle applies all over the body. I always recommend treating the area above and below the affected joint whenever we're dealing with arthritis. So if you've got an arthritic hip, you might want exercises both for your knee and your lower spine. If you've got an arthritic ankle, you might want exercises for your knee and your foot, and so on and so forth. It really applies to any joint in the body. The third mistake I made when treating arthritis patients was skipping the mind-muscle connection. When I was first qualified, I bought into this notion that the only way to fix painful problems was through big lifts like squats, overhead presses, and deadlifts. There were lots of online influencers saying this kind of thing at the time, and I bought into it massively. But this approach is flawed. When people have a painful problem, quite often the big cause of it is a tiny, subtle weakness in some of the tiny supporting muscles around that joint. Big movements like squats and deadlifts do not fix these subtle problems and sometimes can make them worse. Now I focus a lot of my rehab on helping people build a mind-muscle connection to those tiny supporting muscles, and that leads to a much better outcome. Here are some of my favorite examples. One of the best exercises for building a mind-muscle connection around the knee is the inner range quads. All you need for this is a pillow. You're going to fold it in half like this and tuck it under your knee. Let your knee just bend slightly over it. And then you're going to contract your quads by pushing down into the pillow and lifting your heel off the bed. You should notice this muscle here tighten up, and you should be able to feel it activating. And then you can relax it and repeat 10, 15, maybe 20 times in a row. While this doesn't build massive strength, it significantly increases the connection between here and here, and it will protect your knee as a result. For neck pain and headaches, I often give chin tucks on a wall, which is one of the many exercises I show for this problem in my book. Working on activating the tiny scapular muscles that live around the shoulder blade like this before lifting the arm can make a massive difference to many cases of shoulder pain. My fourth mistake when treating arthritis patients was giving up on their range of motion too early. I always knew it was very important to regain range of motion for people with arthritis, but I would start off by doing 1, maybe 2 sessions of mobilizations, and if their range of motion didn't improve instantly, I would say, let's stop doing that and try something else. Now I know that is such a bad idea. Range of motion gains can happen incredibly slowly, sometimes so slow that you don't see a change week on week. If you give up too early, you might be giving up before you've noticed some really meaningful changes. What's more, we also see people improving in terms of symptoms from this kind of treatment, even if their range of motion isn't changing very much. The lesson here is don't give up on treating stiffness too soon. Be patient. The improvements happen over a long period of time. My fifth mistake when treating people with arthritis was not being a better teacher. I wasn't able to show people that their pain doesn't necessarily mean they're being damaged. I wasn't able to show people how much physio can help them, and I wasn't always able to teach people how to get the best out of their exercises. Now, I know you can't come out of the blocks instantly an amazing teacher. I understand that. But what I would have done earlier in my career, if I could go back, is spent more time and money investing in my ability to communicate with people so I could have accelerated the process. So those are my biggest mistakes I made with my arthritis patients. I hope this video has been useful. If it has, do drop a comment below and we can make more videos like this. And I've tried to make up for some of these mistakes by putting everything I know about arthritis into my books and my teachings online. My latest book, Thriving Beyond 50, has got loads of information about arthritis. You can find a link for it in the description box below. And if you pick it up, I hope you enjoy. See you on the next video.